of HIV. The symptoms of HIV, since it is a virus, it will lead to a normal viral infection type reactions or symptoms which will be there in the body, which will include fever, the first one to occur, chills, fatigue, sore throat, muscle aches, rashes. These could be some of the symptoms. And there are different stages of HIV. As I mentioned that HIV can remain for a small phase if it is untreated, goes unnoticed, can lead to a chronic one, and then finally landing up to AIDS. What happens actually during this particular? There are different opportunistic infections which enter inside the body, and how this HIV spreads. There are many ways via it could spread through. It is basically present in the biological fluids, in blood, semen, vaginal fluids, breast milk. So all this when a infected person's blood sample, semen, vaginal fluid, breast milk comes in contact, an individual gets infected. People of all sexes or rather sexual orientations can get infected with this particular virus. The virus can enter through the body and then gets harbored inside. It enters through any cut or wound. And if a female is pregnant, she has a chance that she will pass on the virus along with the antibodies to the fetus as well. Having sex without condoms, sharing needles, taking, taking drugs with those needles, infected needles, these all can lead to HIV spreading. So there are different tests, and I had a question that how HIV can be tested. So I'm just going to open up with it. So I'll basically focus upon the test involved, the types, the management, and the treatment. And there's a question that does HIV go away? So you're going to tell me after this that whether it goes away. So let us have with the stages of the infection. So here, the first stage, as I mentioned, it's acute infection. The individual will develop flu-like symptoms. The symptoms may occur for 2 to 3 weeks, and then, if not treated with local drugs, the infection will go ahead. This particular infection is called as chronic infection now. And after the acute infection stage, this clinical latency that leads to chronic HIV infection. Clinical latency stands for the clinical markers, or rather the cells of the immune system, which play a major role in taking care of this viral load inside the body, can last for decades. That means the body is trying to fight out the infection outside, but still the infection is there inside the body. And a stage occurs when it leads to AIDS. And AIDS is a situation where the number of our cells of the immune systems. Now, cells of the immune system are the one which fight in our body, leading to removal of these bacteria or fungus or viruses which enter inside the body. These cells of the immune system, they are there like the T cells and the B cells. So there are a certain type of T cells which have got CD4 markers present on the surface. So when we talk of the AIDS, the CD4 cells, they decrease. The number of CD4 cells decrease as the infection goes on in the body. So in this particular diagram, what you can see right now, this is the number of cells before HIV infection. These blue colored cells in the test tube, these cells indicate the CD4 receptor cells. During the acute infection, the virus has entered inside the body, and therefore the number of CD4 cells have reduced. They reduce in their number, and the infection is there inside the body, proliferating. Who is proliferating? It's a virus which is proliferating, and because of that, you will see that the number of blue colored cells have reduced tremendously. And as this infection goes on, it could be a decade will take around for the infection to proliferate. And therefore, you will see that everywhere in the test tube, you'll have all the red colored dots. What you can see, this is nothing but the HIV virus, which has increased in its population. And the number of blue colored cell in the last test tube, you will see that hardly there is any. There is one CD4 cell. So as the number goes on decreasing, when the number decreases to 200, the T cell number decreases to 200 or so, then this is said to be the clinical condition that is called as AIDS. I hope you can see my screen changing. Okay. Yeah. So, what are the testing options which are available? The testing options which are available are rapid point of care. Rapid point of care is a very preliminary test. This is the one which it takes around 20 minutes, and what you require is a drop of blood which is taken, and this drop of blood can be tested for either the antigen or the antibody. Both can be checked here. Now, what is an antigen? The one which has entered inside our body, the foreign particle, that is a virus, can be checked for, as well as the antibodies which will be produced by our T cells can be checked for. Now, there is another method which is standard point of care test. These are lab based tests, and these certainly follow the protocols which are similar to that of ELISA. In ELISA, that is enzyme linked immunosorbent assay, this method, standard point of POC, what we call it, SPOC, SPOC, that is the one which is tremendously increasing technique in biotechnology for diagnostic purpose. This is SPOC, standard point of care. So here this test result may take few days for the results to come, for the reports to arrive. So the test is commonly used today and has largely replaced the first one, that is antigen and antibody test. Now there are certain kits available like at home test. Now you'll be surprised to know that at home test, how can you check? It is not a pregnancy kit that you can check that, whether pregnant or not. But this is a test kit where you are supposed to, it's based on saliva based antibodies that can be, it can be purchased online, or it could be available with any retail drugstore. While only thing is its sensitivity is less in comparison, and it can take around 20 minutes for the reaction. Home collection kits are also available in this at home test. So at home test can be one which can be done and could give you results in 20 to 40 minutes, whereas there is a home collection kit that can also be purchased online. These kits are available online, and the antibody test here requires a drop of blood that could be placed on a test card which is present, which is given in the collection kit. So what a person has to do is he has to take a sterile lancet which is also present in the collection kit, and then using that lancet clean the region, take a lancet, your fingertip, and then collect the drop of blood, place it on the test card, and then this can be sent via express mail, pack it properly so that it can be sent to the laboratory, and then you can receive the results either via early or online as early as they process the sample. So this is how the home collection kits are also available. It could be like anonymous entry can be made here for the home collection kit, and then the results will be revealed to that individual either on some other way, like some other email id, or so that your identity of that individual is not revealed. The next is nucleic acid test. These are also blood based tests that are used to detect the HIV RNA. Now, this is HIV is having RNA present in it, and this RNA is inserted in our cells and it combines with the DNA. If they have got an enzyme called as reverse transcriptase. Okay, this enzyme is present in HIV, and therefore it is successful in converting its own RNA into DNA and then merging it with our DNA, the DNA of our cells. So here, what we do is in the nucleic acid test is we take the sample, blood sample, and from that we take out the RNA. So NAT can detect HIV earlier than any other methods. It is basically used to screen the donated blood or test the newborn which are suspected of having HIV. The results appear in a couple of days. So these are the different testing options what are there available. Now there's a period which we need to know, and that is called as a window period. Now for any HIV test, HIV enters inside the body. So there is a period during which it stays inside the body. This particular period is called as the window period. The window period depends on different type of HIV tests which are used. For example, right now I told you that there are rapid antigen antibody tests available, there are home kits available, there are NATs available. So antibody test usually takes HIV and can be recorded, meaning it could give a positive result if the person is infected only after the HIV enters into the individual's body 90 days after that. 90 days of exposure, what we say. So these antibody tests can take almost 3 months and then give you the correct result. Rapid antigen antibody test, what was the first test? It could take almost the similar period, that is 18 to 90 days. Antigen antibody lab test can take almost 18 to 45 days. Okay, so it could be around 1.5 month. Whereas when we talk of 90 days, it is after 3 months. So the first two tests will be recorded or will give possible result. Otherwise, the results will be false negative. If HIV has entered inside the body, there is something called as hibernating process where the infection will then proliferate inside the body. So antigen antibody lab test can detect this particular HIV during an interval of 1.5 after the exposure. Whereas when we talk of NAT test is used to detect the RNA present, right? RNA of that HIV, whether it is present or not in the blood sample. You are checking for that. So that can take almost 10 to 33 days after the exposure takes place. So that's called as a window period. So that's the HIV virus which enters inside the body, and this is the active infection. Now when we talk of active infection, as I mentioned, that viruses, they have got RNA present as a genetic material, plus they have got an enzyme called as reverse transcriptase. Using this particular reverse transcriptase, they convert their RNA into the host cell, and the host cell is usually our T cells containing CD4 receptors. So they enter inside, they take hold of our cells, they merge their DNA with the help of RT enzyme, reverse transcriptase, they merge their DNA into our cell's DNA. That is DNA interactions happen, and here this DNA is the viral DNA which is coding for its proteins. The protein are the surface proteins of the virus which are present. So now these head part and the tail part of the virus which will be synthesized inside our cells. So what are our cells? Our cells are finally the host cell, and in those host cell they try to proliferate. So as they take on one after the other, CD4 cells are coming in connection with it, and they are losing their own functioning, and they are becoming like slaves of the HIV, and they are synthesizing the virus for, it's like virus takes a, without paying any rent, it just stays inside the house, and then it increases, it outnumbers in its population. So that's how the active infection takes place. Now how HIV spreads? HIV spreads by having unprotected sex. Okay, so using condoms is the one way which is the safest way. Okay, so that can, but still in that also there are certain limitations. Okay, and so use of condoms is a requirement for, if the individual's history is not known, okay, then that has to be known. Anal sex is more riskier, and risk of HIV increases if you have more than one sexual partner. Then there are sexually transmitted infections. These sexually transmitted infections also enter, they cause open sores in the genital region, and this sores they allow the HIV to enter the body. Also, injecting drugs using needles and syringes which are infected, that can lead to, or that can lead to spread. Now what are the symptoms? As I mentioned, the symptoms will be high grade fever or low grade fever, depends, sore throat, swollen lymph nodes. Now, lymph node is something which is present in entirely inside our body, and along with the circulatory system, the lymphatic system also works hand in hand. So, there are lymph node present, especially in the armpits. So, they are swollen. There are rashes on the body. There is muscular pain, mouth ulcers, night sweats, and tiredness. These are some of the symptoms of the infected individual. How to prevent that? There are more tools available that can be used. First thing what you can see in the diagram is a use of condoms. That is the way how it can be prevented. The next thing is prep. That is the before the infection has entered inside the body, there are certain antiretroviral drugs available, so they are called as ARTs. So these ARTs will be available, and these ARTs are given to the patient before pre-exposure period, that is called. So PrEP stands for the pre-exposure period, and PEP, the last one, is stands for the post-exposure period. And here these those are the drugs which are given to the patients who are suffering. So PrEP can be, started before the infection, when there is a chance, that a person may think that maybe I am infected, so maybe I should start with the drugs on. So that is PrEP. And what is PEP? PEP is something which is for the long term, because as the last question for the the questions what were placed in the my first slide, I mentioned that does the virus go away? No, the virus doesn't go away completely out of the body, but yes, there is a treatment available which can help to keep the number of cells in a declined phase. Now this is where, this is the diagram. As I mentioned, CD4 cells are low, and you can see that in the pink color tube the viral load is very high. The situation is not good. But in this particular graph, this is the research. I have taken this from a research article which says that the HIV infection was there. When the HIV infection was there, you will see that the graph was at a very higher peak. The CD4 cells, when the infection had just started, the CD4 cells went down, and then they slowly and slowly decreased. The CD4 count dropped. Hello? The CD4 count then dropped quickly, and then within a decade or so the CD4 count went down. So that was a chronic phase where the CD4 count decreases. And when HIV treatment increases at that particular time, there is a stoppage on the viral particle, and antiretroviral, in tablets, drugs which are available. This can lead to increase in CD4 number and therefore can outnumber the viral load. So this is how the virus can be kept at a concentration which will not be, or which will not lead opportunistic infections to enter inside. Because in terms of HIV, the person becomes, immune system goes down. As you have noticed that the main cells, meaning the cells of the immune system, T cells, which are responsible for looking out for whether any infection enters inside of in our body and taking the note of it and producing or synthesizing sufficient amount of immunoglobulins and cytokines and many other proteins and anaphylotoxic reagents which will help to take over the infection and control our body and maintain our body. So that when our body is maintained, the number of cells in our of the immune system, they help each and every organ to function normally. But when the virus load increases, the body is not in a correct phase or not in a healthy phase, and therefore many other infections may enter inside the body. So National HIV Testing Day is celebrated on June of 27th. And who is supposed to go for this particular HIV testing? HIV testing is done if you're a man who has had sex with another man, you had sex with someone who has got HIV and you weren't aware of, you have had more than one sex partner since your last HIV test, you have shared needles, syringes, or any drug injection equipment, you have exchanged sex for drugs. These are especially with the sex workers. If diagnosed with another STI, that is sexually transmitted disease, or maybe you have been diagnosed with or treated with hepatitis or tuberculosis, you have had sex with someone who has done anything listed above, and someone whose sexual history you don't know about. So these people are supposed to go for the HIV test. So, getting and keeping an undetectable viral load, that is, viral load needs to be suppressed all the time. And that is the best thing you can do to stay healthy. So, undetectable equals to untransmittable. And here, if there is silence, then that will certainly lead to death of that individual. So detection, or rather detecting these particular HIV is very very important at the acute stage only. If there is an individual who has so many questions which are mentioned here, okay, that person, that individual should go for HIV testing. And if the test is not done, the infection can go on from chronic leading to AIDS. Anyhow, HIV stigma, there's a stigma in our society because of, as individual who has got or is infected, has AIDS, is looked upon with a different angle. The stigma plays a part of, very important part in an individual's life, especially those who are suffering from. So therefore they hesitate to go for the testing process. So this stigma has to be eliminated out. That stigma should be eliminated out. And when people are afraid of experiencing the discrimination of a person who is suffering from, they are less likely to be treated and tested. So if the testing is not done, then treatment is long away. Treating those in living with HIV can negatively affect their ability, can hamper their regular routine, can hamper their life. Okay, so with that, I get over with HIV. Now I'll move to the next part, that is breast cancer. So, what is breast cancer? Breast cancer is a type of cancer that starts in the breast. Okay, it can start in either one, or it can start with both. How the breast cancer starts? It's like Non-cancer breast tumors, they are abnormal growths. They do not spread outside the body. There are certain types of cancer which are non-cancer breast tumors, and there are certain tumors which are cancerous tumors. So when it is non-cancer breast tumor, then it does not spread. It is not that life threatening. But there are some types of breast lumps which can ruin a female's life. Where breast cancer starts, it, it specially starts in women who deliver milk to the newborns and infants. Why does breast cancer occur? There are many reasons behind it. We are going to cover on these topics. Where does the breast cancer start and the types of breast cancer? The next three questions will be in my slides. So let us first look up to the anatomy of the breast. This diagram is to make you know about the female system, which is having lymph nodes. The lymph nodes, along with there are many lobules which produce the breast milk. There are different ducts which carry the milk to the nipple, and the breast size depends on the fatty tissue deposit inside the breast. This is present just above the ribs as a muscular tissue. Along with that, it has got inside it fatty tissue, connective tissue, which surrounds the lobules and the duct. This is the diagrammatic presentation on the other side. This presentation is how it looks under the microscope. These are the different types of cells, and here you will see that the lobular units which will look under the electron microscope in the following form. So this is the appearance under the electron microscope. Okay, and these are the different types of cells which are present. So these are the lymphatic cells, the T cells, B cells, endothelial cells. These are the linings of the cells or cell types. Okay, luminal cells, what we call. These are the fatty tissues which are present in yellow. Those are the adipocytes, and certain fibroblasts are also present. The connective tissue is also present. So now, what are the causes of breast cancer? The genetic profile, as per the genetic profile, there are 10% are because of the genetic profile of an individual. Proto-oncogenes. Now, what are proto-oncogenes? Normal cells have got certain genes. They are called as proto-oncogenes. Now, these proto-oncogenes help control the growth of a cell and divide into new cells. But if this proto-oncogenes, these get mutated in some or the other way, they become oncogenes. And these cells that have this mutated oncogenes then can become cancerous. Another thing is tumor suppressor genes. Now, normal cells will have this particular TSG genes. This will help in controlling how often normal cells divide and repair the DNA mistake and cause the cells to die at the right time. Tumor suppressor genes. So, if the cell is mutated, the cell has mutated tumor suppressor gene, then again the cell can turn into cancerous. So cancer can be caused by these gene turn on for oncogenes, and when the tumor suppressor gene, the one which the gene which suppresses the tumor formation, that is switched off. And these two things of oncogen on and TSG off, that can lead to breast cancer. Then this, when we call of tumor suppressor gene TSG, there are certain genes which are there. BRCA gene, these are of the two types, BRCA1 and BRCA2. I'm not going much into depth of the genetic profiling. There are less common genes also for this breast cancer. Another is 90% of the breast cancer is acquired. And how it is acquired? It is acquired by coming in contact with certain radiation or drinking alcohol, having excess body weight, some hormonal imbalance can be present in a female who is in the menopausal having menopausal symptoms. They can suffer from this hormonal imbalance. Menopausal symptoms are the symptoms of menopause, like hot flashes, irregular periods, there are night sweats, headache, then there is, mood changes. These all are the menopausal symptoms. And if these menopausal symptoms are cured, then what the doctor recommends is a hormonal therapy. And during this hormonal therapy, what happens is the normal hormone are suppressed and the estrogen increases. And because the estrogen has increased, the level of insulin also increases here. So there is a hormonal imbalance, and this hormonal imbalance can lead to breast cancer. Not having children and not breastfeeding, this could be also one of the acquired reason for breast cancer. Then use of certain birth control pills like contraceptives, in intrauterine devices, certain progesterone shots. These all are the reasons. Using birth control pills also can lead to breast cancer. So menopausal hormone therapy. So hormone therapy is recommended so that the mood swings can be taken off. But then treatment of this hormone therapy, there are certain lifestyle changes like that can be the reason or the cause of breast cancer. Now let us study the types of breast cancer. Breast cancers are usually classified into two main types, I would say. Non invasive breast cancer, ductal carcinoma, abnormal cells are present in the duct. That's the reason the anatomy was shown to you. So, abnormal cells are present in the ducts of the breast, which may develop into an invasive breast cancer. Lobular carcinoma, it's present in the lobules, which are present inside the breast cells. So, they increase, they outnumber, so there is a risk of developing breast cancer. So, these are some short forms are used here, DCIS and LCIS. Next is invasive breast cancer. When I talk of non-invasive breast cancer, there are chances that these they do not move. They are benign type and they remain at one particular site. They do not invade the other parts of our body. They do not spread. Invasive breast cancers include which or almost 80% of the breast cancer present in invasive type. In invasive type, it is starting in the ducts, accounts for 80%. There's a lump which will be observed in the breast or the underarm. There could be breast pain, a change in the shape of the breast. There could be white discharge from the nipple. So these are the symptoms of IDC. Invasive lobular carcinoma, it starts in the lobules and accounts for 10% of the breast cancer. A hard or a thickened area inside the breast is present, or the underarm can be present because the lymph nodes are present, as I told you, in the underarms, in the armpits. So, cancer cells they begin in the part of the breast that makes milk. So, these are the lobules and they can spread to the nearby breast tissues. The next type is called as the inflammatory breast cancer. Inflammatory breast cancer is a type of invasive IDC that has spread to the breast skin. The skin color may change. It will appear red and it will appear swollen. And this type of inflammatory breast cancer grows and spreads faster than any other type. Inflammation stands for that there is some possible fight going on in our body, and that has led to inflammatory response in our body. Redness, swelling, pain, these are the symptoms of inflammatory breast cancer. If they are not taken care of, the body is showing you signs and symptoms, but you are not taking a note of it. So that becomes dreadful later. Next is Packett's disease. Packett's disease of the breast is a very rare type of cancer that forms in the nipple and the skin around it called as areola. It can be a flaky or a red skin patch or a tingling sensation in the nipples. The cancer cells are only present in the lining of the ducts and they are not spreading the whole part of the breast. So this is what are the different types of breast cancers. So these are there are some which will be non-cancerous, benign type, and the conditions that can cause a small lump present inside the breast, or this can be a small cyst which could be a fluid filled sac in the breast, or that can be in the form of fibroadenomas. That is the breast lump which is made up of fibrous tissues. So most of the breast cancer begin in the ducts and the lobule, and breast cancer can spread outside the breast through the blood vessels or the lymphatic vessel, and such a type of cancer is then called as metastatic cancer. So if there is a benign type, non-cancerous, it is non-invasive. It stays at one particular part, can be treated well off. But if this non-invasive becomes invasive, then it will lead to metastasis. Breast cancer does not discriminate. Men can also have breast cancer also. So symptoms of breast cancer in men are very similar to the women. Finding breast cancer early improves the chances that it can be treated successfully. Majority of the men are diagnosed after the age. So age factor is the one which is present in men, but not in women. In women, there is no age factor where the you know breast cancer can start with. A strong family history of the male or female breast cancer can increase the risk of men developing breast cancer. Men who produce higher than normal levels of estrogens may have increased risk of breast cancer. So this estrogen and testosterone level, they mostly affect the risk of breast cancer. Now we got to learn about the molecular subtypes. Right now, right now we have seen the subtypes which were invasive and non-invasive. Now we are going to study about the molecular subtypes. Now here, the molecular subtypes are divided into luminal A, where there is presence of hormone receptor positive, okay, estrogen receptor is positive, and there is one more receptor that is called as the HER receptor, okay, human epithelial receptor. This is present, so here this receptor will be negative, and there will be low levels of another that is Ki 169, Ki67. This will be present. So these are the subtypes. Okay, luminal A. Then we have the luminal B, where we have the HR positive, that means hormone receptor plus estrogen receptor plus HER2 receptor, and there's very high level of these particular parameter. HER2 is HER2 is present, but rest all receptors are absent. There's one more which is very dreadful, and that is called as a triple negative breast cancer. Now, this triple negative breast cancer will show all the receptors negative. Now, here, these receptor presence is very important. If the patient is having breast cancer and if a biopsy sample is taken, these cells are screened for the presence of receptors. And depending on the type of receptors, the medication is recommended for that particular patient. So here, if all the three receptors are absent, then the treatment becomes worst. So therefore, When we talk of luminal A and B, best prognosis, okay, that will go for proper diagnosis and proper treatment. But when we talk of triple negative, triple negative, the chance that you cannot record anything, TNBC, you cannot record anything. So if the receptors are not known to you, what type of treatment will be given to the patient? So here, these are the main intrinsic ones. So targeted therapy can be recommended, but in terms of triple negative, which shows all the three receptors are negative, so it's the most aggressive subtypes and occurs more often into younger women, and it's highly associated with BRCA1 mutation. That is a genetic disorder, as I have talked about it just before previous two slides. So these are the most aggressive ones. Whereas the other types could be treated. If the patient is HER2 positive, then Herceptin is the treatment. Targeted therapy can be given. And for rest of them, tamoxifen is recommended as a targeted therapy. What is a type of diagnosis in terms of breast cancer? A clinical examination is very much important. This clinical examination could be of your whole breast area done by the healthcare professional. This includes checking for the breast, nipples, armpits, and the collarbone of an individual. Followed by mammogram. Mammogram is used, it's like a low dose of X ray which is bombarded onto the breast. And then the radiographer, as you go for X ray, you just have to place your foot or your hand, whatever has got a damage. Okay, but here the breast has to be loaded onto the screen which records. A mild dose of X-ray will be, uh, you know, given to the patient, and then the images will be recorded. The image will be looked out for whether any lump is present or there are any abnormal areas present. So the abnormal areas will appear as whitish in the report. Okay, lump, cyst, all or calcium deposits, that those can be recorded when an individuals go for mammography. 100% result is obtained when an individual goes for mammography. Mammography happens to be a bit painful. Ultrasound. Ultrasound is using sound waves to look for the breast changes. And it also detects whether there is a presence of cyst, that is a hollow cell which is filled with some fluid inside it, or whether there is some lump of tissues present which is a benign type that can be located using an ultrasound. Biopsy is usually recommended for a patient whose mammogram has come to be positive. So, biopsy sample has to be taken. So, a small section, a small tissue from the breast is taken and from the patient is withdrawn and is examined under the microscope. Next is MRI. MRI also produces an image using magnetic field. So women who are under 50 years of age, they are at a high risk of breast cancer, meaning there's some family history maybe. So they are going for a check. So MRI is recommended. Younger women must be referred to the general practitioner or to any specialist. So, being diagnosed with metastatic breast cancer can be devastating, right? So, metastasis meaning it is going to spread inside the body, and for that, if it is currently there is no cure for metastatic breast cancer, because metastasis of breast cancer finally lands up into ovarian cancer. What is the treatment option available? The treatment option available is surgery. So it is usually needed to remove one or more of the lymph node, and this, if the cancerous cell is present, it's this lymph node are swollen and that happens to be inside the armpit region, then this is a surgery which is called as axillary surgery, which is recommended for the patient. There's something called as lumpectomy. Lumpectomy is a procedure not to remove the whole breast, but the process where a small section, a small amount of the breast tissue will be removed off, will be cut off. So there's a complete excision. Okay, wide local excision can also take place. There is another surgery which is mastectomy. This is complete removal of the breast. If there is a cancer which is spread to a percentage is higher, then mastectomy is preferred. Then there is something called a sentinel node biopsy. This is the first lymph node where cancer cell can spread outside the breast. So here it involves like a small procedure where the node is being mapped off, and this is done by inducing some chemical agent inside the body and locating it onto the screen, and then using this biopsy. Okay, it's like a small lymph node which needs to be removed off. Chemotherapy uses drugs to destroy the cancer cell. If the cancer cells are found in the lymphatic system, or then it can be treated, or else in the bloodstream it can metastasize so to other parts of the body. So chemotherapy is recommended. Chemotherapy is like certain drugs which are delivered inside the body using IV. Radiotherapy, if cancer is found in high number in the axillary nodes, then radiotherapy can be recommended to kill the breast cells which are present in the armpit. Then the advanced treatment will be hormone therapy. So hormone therapy is also called as endocrine therapy. Now this uses drugs to treat the hormone receptor positive breast cancers. So majority of the breast cancers are treated using hormone therapy. Targeted therapy. Targeted therapy will be, for example, if the patient is HER2 positive, then the targeted therapy like an immunotherapy in the form like Herceptin is recommended. So that's a form of immunotherapy where the immune cells are boosted with, and these are called as targeted therapy because these receptors specific. These are receptor specific. So if I want to develop a targeted therapy against HRG, okay, HRG, then I need to take the complementary component in along with the drug. So the complementary component to the receptor will go and bind to it and will deliver the drug exactly to the same location, and therefore this is called as a targeted therapy. Immunotherapy, why? Because if there's a receptor, I can have a anti-receptor made inside the laboratory, and using the biopsy sample, I'll take the receptor and form the antibodies against it, and these antibodies can be then delivered along with the drug or the radio element or the nanoparticle, whatever is used as the treatment drug for it. So immunotherapy is very widely being recommended nowadays, and it has no side effects in the form as there for hormone therapy or for chemotherapy or radiotherapy. So immunotherapy is preferred. Only thing is that it is cost effective. The next specific one, that is personalized medicine. This is also termed as precision medicine. This is referred to a treatment approach where cancer treatment is tailored to that particular individual, looking into consideration taking into consideration the genetic profile of that particular individual, and then finding out which type of genes are responsible, and which type of receptors are existing, so that can be done in terms of personalized medicine. So these are certain targeted therapies, hormone therapies, and adjuvant technologies which are available for the treatment of breast cancer. The best way to know is to self examine. To self examine is in front of the mirror. These examination need to be done, and this examination can be done by examining first of all examining yourself. Yeah, an individual should examine herself first, examine under the armpit the presence of any particular tumorous or some lump like formation which could be present. So this is a way out how what is present, like Is there any hardness present? Okay, or any dimpling effect, or anything is dripping off, or whether there is presence of any redness or rash present, or is there any color change, okay, paleness if it is observed. These all are the ways of examining at our own level. An individual, a female, can do this and help in coming out of it. Like, after basic self examination, an individual can go for clinical examination to the GP, general practitioner, and then can go for mammography. So it's an individual can go for basic self examination. This can be done once in a month, every month, the same date. The examination can be done individually here, and that will help, in overcoming the acute chronicness of that this particular disease. So this is a very famous example of the actress who went through the BRCA gene test, okay, and had undergone mastectomy twice, and she is now has overcome. So we have to be strong enough, and strength is very much required in females especially, to come out of this. Is not a stigma that we have got breast cancer, but if we overcome the fact that the cancer is present, but still if you overcome it, that's a big achievement for your life. You can, don't look it in the sense that it is going to lessen your days, but look at the time that how you're going to overcome over it. Okay, so with that, I move up to the next one, that is thalassemia. Tanish, I'll take another 10 minutes more, maybe. So now we move on to next, that is thalassemia. Thalassemia, I have prepared a small part out of it. So thalassemia is actually a blood disorder, and which is passed down through the families. This is an inherited one, and what is caused here is there is a change in the genes which are responsible for the formation of hemoglobin which is present in the RBCs, and these hemoglobin is made up of four chains, 2 alpha and 2 beta. So thalassemia is inherited because there is a defect present in the gene, and this defect can happen in chromosome number 16 if it is defect present in the alpha chain, and it can happen with chromosome number 11 is defective, then the beta chain which is synthesized during hemoglobin formation will be defective. And when hemoglobin itself is defective, the RBC carrying capacity will also go down. So often there is a mild, severe, or severe anemia which will be recorded for these patients. So you can see in this diagram that the RBCs, they are not, the one which are the oval shape, but here you will see that they are in a disc form. And as the RBCs they change, they go in the spleen for their breakdown. And when they go for their breakdown, the number of RBCs decline, and that leads to condition called as anemia. This is the inheritance pattern. In this inheritance pattern, you can see that the mother is having thalassemia, whereas the father is a carrier. There is a chance that 50% of the children will develop thalassemia, whereas 50% will be carriers. When both the parents are patients, all the children will be having thalassemia. When one partner is unaffected totally, but another is a carrier, there is a chance that unaffected females and male child will be there, and 50% will be carrier of the disease. When both the parents are carrier, then there are chances that there is 75%, okay, 50% will be carrier, 25% will not get affected, whereas 25% will be affected. So this is a very important note here, that the inheritance pattern plays a major role in leading to thalassemia. So, thalassemia, let us see what is a classification of thalassemia. Thalassemia is characterized into two, that is alpha thalassemia and beta thalassemia. This alpha thalassemia is there present when there is a defect present in the synthesis of alpha globin chain of hemoglobin, and beta thalassemia is present when there is a defect in the beta globin chain formation of hemoglobin. So accordingly, they have been classified again into major and minor. Okay, major as well as minor in terms of alpha thalassemia, and major and minor in terms of beta thalassemia. So here you could see a bloodstream with a healthy RBC having two alpha and two beta chains. But when we talk of alpha chain, the alpha chain is defective, and in terms of beta thalassemia, the beta chain will be defective. Now, what are the symptoms? Symptoms of alpha thalassemia are the abnormal facial look of that, the head itself is not developed, the face itself is not developed for these particular uh, patients. The cheeks, forehead, jaws, they may overgrow. There's jaundice. Why there is jaundice? Because there is the definite RBC shape has changed, and therefore they all become like defective RBCs. They go into the spleen for their breakdown, and spleen is a region which develops lot of bilirubin and biliverdin out of hemoglobin, because hemoglobin breaks down into globin and the heme is converted into bilirubin. So bilirubin concentration increases, and therefore that gives paleness or yellowness to the child. So there is a lot of bilirubin in the blood, and therefore jaundice, yellowish tinge, extremely enlarged spleen. That could also, so normally this is the spleen size as you can see in the diagram, whereas when in terms, because the spleen is overburdened with every day's breakdown of RBC going on, so there is an enlargement of the spleen region, and that leads to hepatomegaly here. Okay, next is symptoms of beta thalassemia. Again, there are similar types of symptoms like enlarged organs, fussiness of the child just looks and doesn't react, paleness of the skin, okay, failure to grasp anything. Then the spleen enlarges, and that gives rise to enlarged organs, as you can see, the pot belly, then frequent infections, poor appetite, and jaundice. These are the again the similar type of symptoms occur in beta thalassemia. These are the as there is deformity of RBC, so that could lead to thromboembolism and vascular dysfunctioning, meaning the whole number of cells here are not stable, but there are defects present in terms. Deformed RBC can also be because of ineffective erythropoiesis. Now, erythropoiesis is a mechanism where the cells of the immune system are formed, especially the RBCs, and all the different types of WBCs are formed here. So that could lead to anemia. RBC defect is already there. So anemia will be there, cortical thinning, bone marrow expansion will be there. Then this hemolysis will be there because there is a deformed RBC, so that could lead to lot of bilirubin and biliverdin. And when bilirubin and biliverdin are there, they go into the gallstone. Why? Because there is formation of bile acids there. So there is a lot of cholesterol which is combined with that gallbladder, and bile acids are formed here, so that could lead to formation of stones inside the gallbladder, because the gallbladder is always full with that of bilirubin and biliverdin. Please mind it that when spleen takes care of hemoglobin, hemoglobin converted to biliverdin, bilirubin, they enter inside the gallstone. From the liver they enter into the gallstone, and from the gallstone then they enter from the gallbladder, then they enter inside the intestine. But here what happens is continuous supply of bilirubin, biliverdin, bile acids, it leads to formation of crystals inside the gallbladder, and that leads to gallstones. Next is because there is iron deposition taking place, there's a lot of hemoglobin breakdown, so there's a lot of iron which is being deposited everywhere inside the body. And if that deposition can take place in some of our organs, that could be parathyroid and thyroid gland, pituitary gland, pancreas, testes, and ovaries. These iron will be excess because every day there are so many RBCs which are broken down. So that could affect the functioning of these particular glands. So that could lead to endocrine dysfunctioning. Also, liver is the one which is going to process bilirubin, convert it into conjugated bilirubin. So here it could lead to formation of fatty liver or cirrhosis can happen. And the heart also, there's a lot of iron deposition can lead to heartbeat, and heart failure can also result from it. Now, what is the approach for the diagnosis of thalassemia? First of all, the history of the patient is looked for. It belongs to which particular race, what is the family background, what is the age of onset, and then go for clinical examination. Clinical examination will involve first looking at the appearance of the person, okay, pale face, hands, color of the skin, jaundice. Because of jaundice, yellow tinge is there, splenomegaly, that is pot belly, appearance of enlarged spleen, skeletal deformity, as in alpha thalassemia, pigmentation takes place. Then, what is looked up for? A general CBC is recommended by the physician. So, when general CBC, what he is going to look for? Normally, hemoglobin concentration, it will be very low. MCV, MCH, these are the factors which actually are recorded depending on the RBC content. So these levels will also go down. RBC inclusion will not be stable. That means it will not be in the normal range. RBC inclusions are present in the blood or bone marrow, and hemoglobin H precipitation can be observed here. Okay, these are Heinz bodies which are present inside. So again, that becomes too much clinical, so I won't cover that. Hemoglobin electrophoresis. So here the blood sample is again undergoing another analysis, and that is called as electrophoresis. That is separation of proteins based by application of electric current. So based on the charge per mass ratio, the proteins will be separated. So inside the blood, there are proteins which are like albumins, globulins. Okay, serum albumin, serum globulins are present here. Fibrinogen, there are many other. Hemoglobin can be separated here using hemoglobin electrophoresis. So from the globin section, these can be further electrophoresed, and then hemoglobin can be separated. Now, the normal adult hemoglobin, which is present generally, is HbA, okay, and HbF is also present to some extent inside the normal individual. So here, this hemoglobin electrophoresis and the CBC helps us to confirm whether the patient is suffering from alpha or beta thalassemia. So here is a CBC report, okay, of the hemoglobin percentage. So these are the four different types of like beta major, beta minor, alpha major, and alpha minor. Okay, so these are the concentrations. Normally the male will have 13 to 18%, okay, as the hemoglobin level, but you can note here that what could be the percentage of hemoglobin dropping down. When we call alpha trait and beta minor, that means they are in a stage where they are carriers. But when we talk of major, that is beta major, and alpha HBH, that is alpha major, there the concentration of hemoglobin will go down to 8. Okay, so that is a drastic situation here. Then females will have MCV level also. It will be comparatively lower here. Okay, 80 to 100 is the value what is recommended, which is the normal value. So here all these parameters which will be disturbed. Now looking at the electrophoretic profile, when we look at the hemoglobin of an electrophoretic profile, refer in terms of the normal individual and that of a control one. So in the normal individual, when we talk of hemoglobin, I said that HbA, hemoglobin A, and hemoglobin, fetal hemoglobin, is also present in an normal individual, and a bit amount of HbA2 is also present in a normal. So this is a site of application for all the sample. Here normally individual should show HbA and HbF to some extent, and HbA2. But when you talk in terms of beta thalassemia, let us see with beta thalassemia and compare it with the normal one. You will see that HbA, which is the normal hemoglobin, is as that of hemoglobin F appears to be more, and also hemoglobin A2 appears to be more. Okay, similarly when you compare it with the trait, in the trait that is the silent one, that is a carrier, HB8 will be there, but there will be F as well as A2, so this will be a carrier. Okay, and then when we talk of HBA, here HBH will be more in terms of alpha thalassemia, and for beta thalassemia major, HBF will be more. So here this electrophoretic profiling helps us to find out whether the hemoglobin electrophoresis helps us to find out whether the patient is a carrier or a infect has got the disease. Now, what is the treatment option available? Treatment of thalassemia, it involves regular blood transfusion. So depending on how far is the disease been progression has taken place, so the blood transfusion will be recommended, and folic acid is recommended for blood for for the formation of the erythropoietic cells. And here if you receive blood transfusion, you should not take iron supplements because iron is already present because of the breakdown of RBC is taking place. So therefore there is high load of iron inside the body, so they are then recommended with iron chelation therapy. So there are certain drugs which are here these iron chelation drugs will take care of the excess of iron which is there inside the inside the body because of high breakdown of RBC. So person who receives significant amount, they need to have chelation therapy to take care of excess iron. Bone marrow transplant may help treat the disease in some patient, especially in terms of children. Splenectomy is recommended because the spleen is the organ which goes on increasing, and that's the organ which goes on degrade, breakdown of RBC takes place. So hematopoietic stem cell transplantation can also result in increasing the hematopoietic stage, so the number of RBCs can be built up. Again, gene therapy can also be recommended here. So there can be mutagenesis can be recommended is the technique which are uh, available for gene therapy. So that gene which is has an expression of a defective alpha or a beta globin gene that can be corrected for, so that gene therapy can be also one line of treatment. So knowledge and awareness is very much required. Poor awareness and lack of knowledge leads to increased thalassemia. Those are the silent carriers. Premarital testing is not recommended in countries, and it's not legal, and for various cultures it's not correct for premarital testing of whether the patient is having thalassemia or not. Inadequate knowledge results in continuous suffering of the patients in a slow and painful course, finally leading to death. So, the only way to prevent the disease and reduce the mortality is by educating the general population. So, the most effective approach to reduce the burden on the society is by implementing carrier screening program, which is premarital screening is recommended, so that now you have seen the inheritance pattern. So if it is a carrier, then there are 50% chances that the child which is born will carry the genetic profile. So amniocentesis will be recommended. So genetic counseling is required at this particular stage. Okay, prenatal diagnosis, that is amniocentesis, is one way out how it can be checked for whether the child is having thalassemia or not. If the child has got thalassemia, then that type of pregnancy can be selectively terminated. So thank you for your patient listening. Over
Uh,
to you, Tanish.
thank, thank you so much, ma'am, for that truly eye-opening and informative session. Now it's time for the much-awaited Q&A session. So, with your permission, ma'am, we'd like to go ahead with the Q&A.
Yeah, sure.
So, if anyone in the audience has any doubts or queries that they'd like to ask, please unmute yourself and ask. Also, you could drop your questions in the chat box.
Uh, I would request you to give me a minute. Give me a minute and I'll be back. Okay, Tanish? Running low out of my battery. So I'll just.
Yes. Sure.
Yeah, hi, Ishwari. Yeah, you can start with the questions. Tanish had sent me a few questions.
Right, right, right. She'll be covering those
Yeah.
right now.
Yeah. How can technology help in detection and treatment of HIV? I think that part was clear during the session. And gene therapy for treatment of thalassemia, that part was also clear, I think. So, how can students build a strong profile starting from their first semester for research or in medical biotechnology? And what are the internship projects would be recommended for someone interested in disease research? Okay. Now, this question is right from the first semester. It's really not possible because you don't have that much knowledge. You don't know what is basic microbiology, basic immunology, and these basics are very much required. So if these basics are not there, then it is really difficult for you to, and nobody will grasp you without the knowledge. So practical knowledge is also very much required. So practical session are usually in your second years, right, for immuno, micro, and biochemistry. So these practical sessions are recommended, and after that only one can go for some project which are available, in different sectors, whether that is with reference to medical institutes, hospitals, okay, or somewhere with BRC or TIFR. So you have to apply for summer internship. They usually give it to the third year, last year project students, or after completing 2 years at least of your undergraduate studies. And there are different courses available for related to medical biotechnology, where you learn in techniques which are used in biotech sectors, as well as different clinical practices, okay, which will help to join as a trainee first in any pharmaceutical industry in the R&D department or so. But it could be there in industry during their last year as the or an internship program after your 4 semesters are completed. That's it. I will just refer to the chat box. Are there any questions in the chat box? I haven't. Is breastfeeding recommended in newborns born to HIV positive mothers? HIV positive babies have already gone, it's not recommended usually because they may happen to spread the infection more to the child.
Okay. Does anyone have any more doubts? Yes, Ashwika, please unmute yourself.
Hello, ma'am.
Yeah.
My question to you is, does PCOS or irregular menstrual cycles have any link to breast cancer risk?
Yeah, it's a good question. Now, this could be again a hormonal therapy, right, which will be recommended because PCOS and all is related to hormonal imbalance. So in this case, what treatment is recommended, that plays a very important role in order to balance the hormones. In order to balance the hormones, the gynac will recommend hormone therapy where the estrogen, progesterone levels will be increased here. So here, what dose is recommended, that is very important. In PCOS, again, hormone treatment is recommended, but the dosage has to be low. If high doses are given, then the body becomes continuously used to it, and the cancer cells they may develop in a very high dosage. But whatever gynac will prefer is going on for a low dosage initially and to see the effect. And depends, if the effect is not shown in the patient, then maybe there are chances that the dosage will be increased. But yes, if PCOS is there and low dose is recommended, then that should not be a problem.
Thank you, ma'am.
Yeah. Any other?
Yes, I have a doubt.
Yes.
Yes, ma'am, you said thalassemia requires long-term blood transfusion. So, what is the long-term effects of these blood transfusion on the patient?
What is the effect? Meaning there will be an iron load, okay, every day on that patient. That iron load could be supplemented with a chelation therapy so that that excess iron can be taken care of. Blood transfusions will be there periodically given to the patients. Okay, so that blood transfusion will give the exact number of RBCs functioning in a manner to take up with the oxygen and for the normal functioning of that individual. And the but these RBCs, they'll be broken, they have a period after which they are broken down. So when they are broken down, they will finally land up in the spleen, and there will be excess iron load here, and therefore because of iron load, chelation therapy is recommended. Following that question of PCOS, Surendra, yes, they are predisposed to breast cancer or ovarian cancer, if depending, as I mentioned, depending on the dosage. The dosage of hormone treatment is important, because for individuals who are like going for pregnancy, but still there's some issue with the pregnancy, and also they go for progesterone treatment, and also there also the risk increases. Then there are certain IUDs also, there are certain contraceptives also which increase the risk, but people are not aware of it. Very few are aware of this fact that IUDs, intrauterine devices, at a very, now there are different types of pharmaceutical products available which can prolong. Now the females do not have a cycle like every monthly cycle. They can, after kids are born, maybe ladies go for inserting that IUDs and then going for a long life, like long life meaning it has got a period of 5 years or so. But it depends on what is the amount of hormone which is released during each day from the IUD, because that there are certain instruments which have got the hormone in it, and that will be released. So that's called as a controlled release drug delivery system. So in controlled form, the hormones should be released. If it is released at a very every day there is a input of a long high dose, that high dose will somewhere affect the body in long run. I hope I have answered your question, Surendran. Sorry, I'm unaware of this.
No problem, ma'am. Thank you so much. Really good talk. Thank you. Very informative.
Okay, thank you. Any other questions?
So, I guess there are no more questions. A huge thank you once again to Dr. Reshma Pol ma'am for taking your time out for clearing all the questions. So now I would like to call upon our vice presidents of the club, Retractor Namita Kini and Retractor Shiv Siddhantes, to deliver the official vote of thanks.
Good evening, everyone. On behalf of the Rotaract Club of D.Y. Patel School of Biotechnology and Bioinformatics, Satellite City, I, Retractor Shiv Siddhant, along with Retractor Namita, the Vice Presidents of the club, would like to thank Dr. Reshma ma'am for sharing such valuable insights regarding HIV, breast cancer, and thalassemia. Kudos to our team ComServe as well for putting this project together so well. A big thank you to all the participants for joining and making Project Kartavya a success. Thank you so much.
Thank you all. Thank you, Tanish, for getting connected. Thank you, Meghna, for recommending. And thank you. It was a great session here. My pleasure. Thank you so
I would
much.
now like to call upon Protractor Meghna Dantuluri for adjourning the meet.
Thank you for the session, ma'am. It was really informative and it was wonderful to be honest. I hope I'm audible.
Yeah, yeah.
I, Retractor Meghna Shweta Dantuluri, the president of Retract Club of DYPSBB Satellite City, hereby adjourns Kartavya Phase 1. Thank you so much, ma'am.
Thank you.
Thank you so much for
Uh,
joining us, ma'am.
Thank you, Tanish.
I would now like to request everyone to please switch on their cameras so that we can capture this moment. Uh, I'll count to 5 before taking the screenshot. Okay. 5, 4, 3, 2, 1. Smile. Okay. So now, finally, a huge thank you for everyone who could join us today. And thank you for taking time from your busy schedules, even on a Sunday evening. So, your presence was truly invaluable and it shows your commitment to health and awareness. So, please feel free to disconnect now. Have a wonderful rest of the day ahead. Thank you.
Thank you.